everyone, and welcome. And thank you for taking the time to join our session today on the impacts of COVID-19 on volunteerism in the Caribbean. We're very excited to be part of the RC3 Long Nights of Research. In the interest of time, because we have to keep strict time, I'm just gonna get started, and hopefully others would fall in as the presentation continues. So my name is Vanita Redoy, and I am the research assistant with the Caribbean Disaster Risk Management Reference Center, also known as CADRIM. And today I will be joined by Ms. Julia Simmons, who is the operations manager with the St. Vincent and the Grenadines Red Cross Society, as well as Ms. Sylvia Jacobi, the health officer at the Suriname Red Cross, and Ms. Ketura Stapleton, who is a volunteer with the St. Vincent and the Grenadines Red Cross as well. So, as you know, the IFRC, as well as national societies, we all work very closely with volunteers to help build community resilience and assist with disaster response activities. So it is because that volunteers play such a crucial and vital role in everything that we do, we thought it was important to take a look at the impacts of COVID-19 on how we interact and work with volunteers. So just to provide some Caribbean context as it regards to the COVID-19 pandemic, as of the 8th of March this year, there has been over 4 million COVID-19 cases, positive cases that is, with over 37,000 deaths within the Caribbean. And we all know some of the major restrictions that came about because of the pandemic. So there would have been nationwide or island-wide lockdowns and restrictions in the number of persons that can gather in the public, as well as how we socialize with each other. You know, there were many changes. Unfortunately, many persons were also asked to work from home, or in some cases temporarily or even permanently lost their jobs. So I do have some statistics in the St. Vincent and the Grenadines during the period of April 2020 to June 2021. Over 2,000 persons were laid off from their jobs, with over 5,000 persons submitting claims to receive unemployment income support. And this was also very similar in Suriname, where unemployment rates increased, with 20% of low-income households having reported at least one member losing their income. So these restrictions also came with, also affected the mental health of persons, staff, volunteers alike. And there was one particular study that showed that 52% of 15 to 29-year-olds in the Latin America and the Caribbean countries experienced more stress, with 47% having episodes of anxiety and panic attacks during the pandemic. So needless to say, the COVID-19 pandemic has definitely impacted our daily lives and almost everything that we do. So that was just a quick snapshot of the impacts of the pandemic on the Caribbean. So today's agenda, I'm going to give an overview of the case study. The case study was done on the impacts of COVID on two particular countries, St. Vincent and the Grenadines and Suriname. So we are also going to hear from Julia, who would tell us a bit about the St. Vincent and the Grenadines experience, and then we will hear from Sylvia, who would give us an overview of the Suriname experience. And then at the end, we would hear from Ketura, who is a St. Vincent and the Grenadines volunteer, to give us her personal experience of volunteering during the pandemic. So this is some information about the case study. We looked at different key areas, and some of these key areas would have been the overarching volunteer policies. We also looked at data management, volunteer protection, of course, volunteer training, volunteer motivation and experiences during the pandemic, as well as volunteer reward systems. But because today's session is only 45 minutes long, we are going to focus on volunteer protection, as well as volunteer motivation and experiences during the pandemic. So the methodology used for the case study, we would have looked at secondary data through policy review. So the St. Vincent and the Grenadines, they have their own draft volunteering policy. The Suriname Red Cross, they use the overarching IFRC volunteering policy to guide the way they interact with their volunteers. We also got primary data through a volunteer survey. So we would have administered the survey using the COBO Collect application. And this survey was really to get a better understanding of how volunteers assisted in both countries during the pandemic, understand why they chose to volunteer during the pandemic, and how they felt while volunteering. We also collected primary data through interviews. We interviewed the volunteer coordinators of both countries, St. Vincent and the Grenadines and Suriname. And this was just to better understand the national society side of it, how they were able to adapt and cope with the changes brought about by the pandemic, as well as to understand some of the methods used by the national societies to ensure the safety of their volunteers while volunteering. And then we also got secondary data through a literature review of any relevant documents. So before we go into the findings, I know a lot of you may not be familiar, or you may be not part of the Caribbean. So I just wanted to give you a nice little introduction to the two countries. So St. Vincent and the Grenadines comprises of 32 islands and cays. So they are very tiny. They have a combined size of approximately 389 square kilometers, with a population size of just over 110,000 persons. The island, as most Caribbean islands, are prone to hurricanes, landslides, coastal flooding, and drought, but they have the added risk of earthquakes and volcanic eruptions due to the presence of the La Super volcano. As compared to Suriname, Suriname is actually the smallest country located in the South American mainland and has a size of approximately over 160 square kilometers, with a very small population size of over 600,000 persons. The country is just a few meters above sea level, and it's definitely prone to river and coastal flooding, as well as wildfires. So I'm going to quickly pass it over to Ms. Julia Simmons, who is going to give us an overview of the St. Vincent and the Grenadines experience. Over to you, Julia.
Welcome, everyone. My name is Julia Simmons, as Vanita would have said and introduced me, and our pictures of beautiful St. Vincent and the Grenadines. And for us, our volunteer system was basically similar to the other islands, and the structure is similar to other islands in the Caribbean. For us, our volunteers were generally, like the general public, scared. And quite naturally, they should have been. And it was not enough information they were receiving at the time, early in the pandemic. However, we engaged our public stakeholders, the Ministry of Health, and started from that aspect because we are always in close contact with public stakeholders. So our volunteer groups at an early start, when the information was not concrete as it should have been, because the rapid context of the COVID-19 pandemic kept changing and changing, we at an early stage started our contact with volunteers through the Ministry of Health. We collaborated, started WASH sessions internally with our volunteers so they can go out there, understand how to be safe, and was able to communicate that information as well to their families and such and be safe. Our volunteer groups is based on the geographic location of our country. It's very mountainous and many of the roads are below hillsides. And we have very coastal communities, but our groups are widely dispersed. However, that is an advantage for us in St. Vincent because we have a strong volunteer capacity or volunteer base. So any emergency disasters and such, we have a huge capacity of volunteers that are always ready and willing to work and to support the National Society and their communities. So they're generally asked to assist with national response, such as the pandemic. And if we really look back at many of the trainings that Federation gave, such as the ECV training, epidemic control for volunteers in the Zika pandemic, and you can look at some of the WASH training that us as Caribbean national societies would have received, and all of this training automatically started to fall into place and have our volunteers with a background that was able to support themselves and to stay protected and quickly understand what was happening to them, right? So when they're asked to assist with national response, it would generally be through meetings face-to-face and through our leaders in WhatsApp chat groups who would disperse the information as well to their groups. Face-to-face meetings may not just be to give information, but to give quick updates on the present context of the disaster and what you should do to be prepared, stay safe, and help your community if you can. We always encourage volunteers, of course, to make sure you're safe first, because if you're ill, you can't help anyone. And if your family is not safe, you can't help anyone. So our main focus is to make sure that you're safe and you understand what is happening to you and around you. And then you can come out and say, I want to help. So generally, they would lend their support to the National Society by saying, I'm available to do this, I'm available to do that, as well as we have data that speaks to persons that was trained in various areas of volunteerism. And we can call you and say, are you available? Are you okay? How are you getting? Are you able to get here? Are you able to participate? Can you suggest someone else? And with that, through WhatsApp groups, various apps that we reach out our volunteers through, it basically helps us here in St. Vincent for volunteers to come out freely and say, I can do this, and I'm available to do it. So as I said, we started with early awareness sessions through the Ministry of Health, where we engaged them. And that would have been at the end of February of 2020. And reaching out to them, they said, we'd like to do an in-house session with our nurses and our community workers and your volunteer heads as well, for the youth groups, for the adult groups. And that information in that gathering came out, what we know right now about the pandemic, what we can do right now, and how to protect yourself. There were some brief WASH sessions that helped volunteers as well. And as I said, all of that training that sometimes we may think, oh, it's a lot of information from Federation, it really cemented our background of how we as a volunteer here in St. Vincent, and I believe even the other national societies were able to cope, understand what was happening, and be able to stay safe and help. We moved from that to understand a little further as the pandemic grew, we needed to have hygiene kits distributed as well to our volunteers. And sometimes the packages would include cute little zipper purses that would have in your mask, your sanitizers, information as well, tissues, whatever you needed to stay safe when you go out or to come to us, or when we're coming to you, or you need to have your family safe. The really great thing about our national society, when we think about the volunteers, we always think about their family as well, because if you, the volunteer, is protected and your family is not, you're still coming back out of a bubble or going into a bubble that's going to cause a reoccurring pandemic. So we had a lot of distribution of hygiene kits and face shield and sanitizing liquids locally as well. When we ran out, we have a company that actually supplied us with sanitizing liquid that was made from 80% alcohol. And we were able to share this and bottle them and ensure they were sent out to the groups, to the volunteers, to make sure we're ready. And if you think about having a volcanic eruption to work in, and then having in that eruption a hurricane, you had to have these kits going out as quickly as Federation sent them, private donors, PIRAC sent them, the Canadian Red Cross sent them through our CRB project as quickly as they came. We don't have a large storage here in St. Vincent, but we made sure these PPEs were just rolling out constantly to volunteers to make sure that they are protected and able to come out and help. We even went further to help our stakeholders, such as in the quarantine centers at our international airport. We packed kits for them for each of the rooms, so there's no cross-contamination. We assisted publicly with electronic boards in sharing information. It was quite a number of information, but for us, our sessions, as much as we give information, we had a little bit of challenges. I think everybody had this as well, because the information was coming so rapidly, the change in context, the change in variants. You had a rapid growth of apps. Every week it was Teams, it was Zoom, it was something else that you had to sign on to and log on to because you're at home. How do you go to work? How do you connect? And what if you didn't have the technology? That was a challenge. And what if you didn't know how to use the technology? So then we had to quickly have these sessions and PSS and try to help people from that distance how to connect and bridge that gap to make sure you're safe still, you're connected, and you're able to get that information through all of these sessions. So for us here in St. Vincent, that was our other challenge. In a pandemic, a volcano is erupting around us. And in a volcano eruption, a hurricane basically came. So we had a host of challenges amongst the pandemic that we were trying to survive and understand and function and keep ourselves protected and make sure our volunteers were safe. And we had volunteers that we can still count on, because without our volunteers, that Red Cross image dwindled in the sense of the workers in the community. And we have a lot of brave volunteers, and I wouldn't trade them for anything and working with them. So before the eruption of the volcano, that's another quick information. How do we get to you? How do we save the vulnerable? And under our volcano plan, we had a number of roles and responsibilities. How do we get those done and still function in a pandemic? So again, we had to have the provision of PPEs, masks and shields and sanitizers. And of course, we had to have all of those gowns and shields, because not enough was known about the pandemic, and it was rapidly changing, as I said. And it was important for us here in St. Vincent to quickly adapt, to be able to save lives, save our volunteer lives, the public, and get that information out there and ensure that there is some sense of normalcy. But it really wasn't just like for everyone else in the Caribbean. It really wasn't for the global world. We had, in that volcanic eruption, we started looking at helping our community evacuation, the vulnerable. And at some point, we slipped on helping our volunteers, and quickly again was able to adapt, have a volunteer desk designed and ensured by our DG and other persons, heads in the National Society, to make sure we reach out to volunteers through direct calls. How are you? What are your needs? Please tell us. Don't be afraid to share how you're feeling, even if you're sick, so we can help you early and give you that care early and make sure that you're safe and you get better early, and what not to do, where not to go, what you shouldn't do. And then, as I said, in the middle of that, you had a hurricane that's coming towards you. Okay, so what do we do? So that context had to be ramped up again. And you find that we had a lot of partner national societies such as PIRAC. Of course, we had the International Federation. As quickly as they had the PPEs and the NFIs to share, they would ask you what you want, like everyone else, and you had to make sure you can have it done. You had your volunteers protected now and would go to the vaccination tents with the Ministry of Health, as you're seeing here, and assist, support, encourage persons to get vaccinated, and encourage persons to keep protected. It's not safe to go out without a mask, and to ensure these things were happening. So our treatment of volunteers is basically what helped them to be able to stay connected. We have, during the pandemic, our landline was changed also into a WhatsApp number. So if we were at home, you could reach us. Dedicated volunteer manager and volunteer desk. And as quickly as the context changed, as I said, we tried to adapt to make sure we're there, or at least it doesn't happen again, because we know lightning very often doesn't strike twice in the same place. But we wanted to make sure that as quickly and as near possible that we can fix these issues as they came. We tried to get them adjusted. It wasn't perfect. Some fell through the crack, but we were able to make sure we still have our volunteers with us and they have that confidence.
Thanks, Julia. I would now invite Ms. Sylvia Jacoby from the Suriname Red Cross to talk a bit about the Suriname experience.
Saying thank you for the opportunity. When COVID became a pandemic, we sent out a WhatsApp group to everyone and asked them if they were available, what would they like to do. So, and we also created a WhatsApp group specifically for the COVID assistance, and we started working from the different volunteer groups, youth, disaster management, health, welfare, and so on. And volunteers could they were free to tell us where they would like to assist, what they would want to do. Next. And we started meeting also on monthly basis. The first thing that we started to do was doing awareness session. First, we did the awareness session for our volunteers because we wanted them to be equipped when they would go into the community, and then also hand washing sessions. In 2011, we had posters that we had developed for hand washing technique, and when we got a fund, we just reproduced those posters and we started distributing them again. Also, the check-in with volunteers, as I mentioned earlier, through WhatsApp groups and phone calls. And we were having monthly meetings with the volunteers most of the time virtually because there was lockdown. Next. We at some point we were asked by the government to assist at the hospitals. But before that, we were doing home checks to COVID-19 positive persons at home, but also from persons that were coming from other countries, people that came back home. They were either at home in quarantine or at a hotel, and we were doing the home checks. Also, food distribution, we were asked to also assist with that part from the government. And in one of the districts, there is a hospital there, and it's at the border with French Guyana. Our volunteers were also working there by screening persons that would want to cross the border. Next. We started working in April 2020, and a year after that, we had a third wave. And at that point, because there were so many infections, all the hospitals were full. They had to put those big tents outside of the hospital, but they needed extra people. And we were asked to help in 2 hospitals. But as I mentioned earlier, before sending out our volunteers, they were trained. So they were trained in, besides doing the health checks, but also how to how do you say it? How to transport patients and so on. And they were working in those 2 hospitals. They were doing shifts, and because the health system was at that moment code black and they needed more help, and we had approximately 53 volunteers that were working in a relation system. So you had some people that were going in the morning from 7 to 3, and then others from 3 to 7, and so on. And then we were working in shifts. Sometimes we would have 6 or 10 volunteers at one hospital, depending on the need that the hospital wanted. We had provision of PPE through the IFRC project. We were able to stock face masks and shields, hand sanitizer, gloves, and also long sleeve gowns. But also, if organization or persons needed it, we could come to Red Cross, because at that time, if you wanted to visit someone in the hospital, you needed to have these things, and some people did not have it by themselves, so they could come to us, and we would provide it. Every time we would go into the field, we would do the detailed safety brief, especially when we were assisting at the airport with people coming in the country, and they would have to go into quarantine. So the whole cyclist thing, logistic and so on, we were coordinating that for the National Disaster Office. But we make sure that our volunteers were they know what they were doing, but also that they were safe. So how to interact with the people, even though we would do it every day. At the beginning, before we went into the field, we would have this safety briefing, and also at the end. And the check-in with the volunteers, we continue doing that because at some point everyone was tired, and when it was needed, we would visit our volunteers. Yes, and when it was needed, we would visit the volunteers. Next. You could go to the next slide, please. Yes. We also offer psychosocial support to our volunteers. At some point, everyone was, let's say, it was tired. We were helping other people, but we realized that we have to look out for ourselves. So we organized sessions with psychologists, and they would come in and have sessions with the volunteers. And we were also available for people who wanted personal sessions and so on. And of course, everyone, you were not, it was not, we advise our volunteers that it was better for them to get vaccinated, especially if they wanted to help in the hospitals, because they would be working with people that were COVID positive. Yes, and also our training for first aid, we had to come with new ways to engage with to do the training. It was, we would be still able to do the training, but also that it was safe for the people. Yes, and I think that was my part. Thank you.
Thanks, Sylvia. And I would now like to invite Ketura Stapleton, who is a volunteer with the St. Vincent and the Grenadines Red Cross, to give us an overview of her experience volunteering during the pandemic for the La Super volcanic eruption. Ketura, over to you.
My experience during the COVID, it was a bit scary, but it allowed me to interact with people. It teach me a lot. I learned a lot during the COVID and also the volcano. And it helped me to get grown, meeting other people, share my experience with them. Listen to them and stuff like that. And it was
Could you tell us a bit about how the National Society ensured your safety while volunteering?
okay. Well, they give us kits, PPEs, we have our gloves, our face masks, sanitizers, and stuff like that.
Okay, and how did you personally assist during the La Super volcanic eruption? Were you part of the team helping with evacuations or with food distributions?
Yes, I was, in my community, I was helping out with the evacuation in my community. And yes, I was helping out also with the food distribution and giving out hygiene kits to people around the area.
And tell us a little bit about why you chose to volunteer during the pandemic. Because you mentioned before you were a bit afraid of contracting the COVID-19. So what made you decide to help with the...
I choose to help because there's a lot of elderly, especially in my community, there's a lot of elderly that need assistance. Most of them cannot do things on their own. So I decided to help them. Not all of them, most of them who needed the help. Yeah, I think it's allowed me to meet individual, allow me to help also, and at the same time give back to the community.
Okay, great. Thank you so much for that, Ketura. We really appreciate hearing that even though you were afraid of getting COVID-19, you know, you still felt passionate enough about helping your communities and helping the persons in your country. So we really appreciate hearing your perspective. So that brings us basically to the end of the presentation. So now we're going to leave the floor open to your comments, questions. You can ask any questions that you have. We have 3 minutes remaining, so I'm also going to put my email address in the chat so that if you don't get an opportunity to ask your question here, you can always send it to me via email, and I would try to get a response back to you. Does anyone have any questions?
Good morning, Decima Hamilton, St. Vincent and the Grenadines Red Cross Society. Thanks to the presenters this morning for giving us the information, taking us back to their individual journeys. I believe from your end, as the organizers of this morning's activity, that you would have been trying to capture or ascertain certain basic information that you already have. Was there anything, particularly from the St. Vincent standpoint, that, you know, would have clicked with you as a Red Cross Society that we may have gotten right or may not quite have got? You may be a little modest in answering the not gotten right part. But I mean, I'm particularly impressed with the presentations, but is there any takeaway that perhaps we can share with the rest?
I think some of the takeaways could be what the national societies did, like the...
Hi, so Vanita is just coming back online. What I would ask is if you can place all of your questions or comments in the chat, and if we are not able to address it due to some technical difficulties, we will address it separately via email. So if you do write a comment, please put your email in the chat and we will respond to you individually. I do apologize for the technical difficulties on our end.
Hi, my apologies again. But yes, just in a way in which the national societies were able to ensure the safety of their volunteers and also connect with their volunteers. See Anisha saying, okay, sorry, I'm getting a message that we have to end the session. Our time is up. So please send me your additional questions or comments. I put my email address in the chat so you can feel free to do so. Okay, thank you very much. And thank you to all the presenters for a wonderful presentation, and Ketura for her volunteer perspective. Okay, thanks everyone.